debate. The Honourable Member for Brampton Centre.
Thank you, Mr. Speaker. As everyone sitting in this House knows, the toxic drug supply and overdose crisis is devastating communities throughout Canada. Now, we are losing 20 Canadian a day, and prior to COVID, 10 people were fatally overdosing every day in Canada. But now it has increased. Many more of our friends, families, and community members are being hospitalized, calling emergency support services, and grieving lives lost over the past 7 years of this crisis. Unfortunately, we're now debating a misguided motion rooted in outdated ideology that would recycle and discredited narrow approach rather than a comprehensive plan to deal with the crisis that is killing people. Even former Prime Minister Stephen Harper's public safety advisor, Benjamin Perrin, has seen the light and describes the current conservative approach epitomized by this motion as, quote, rehashing conservative war on drugs tropes that have been long since discredited and have been found to be not only ineffective but costly and deadly, end quote. There are 4 pillars recognized internationally that are necessary for a successful substance use strategy: prevention, treatment, enforcement, and harm reduction, including safer supply. In December 2016, our government launched the Canadian Drug and Substance Strategies, which uses a public health approach to substance use. In doing so, we committed to a comprehensive, collaborative, and compassionate and evidence-based drug policy. Under the Canadian Drugs and Substances Strategy, the Government of Canada has taken evidence-based action to address the toxic drug supply and overdose crisis and announced over $1 billion in funding. This funding includes $490 million throughout Health Canada's substances use and addiction program to support community-based treatment, harm reduction, prevention, and stigma reduction activities. In addition, this funding has supported research and surveillance activities and strengthened law enforcement capacity to address illegal drug production and trafficking. Going forward, the Canadian Drugs and Substances Strategy will continue to guide our government's drug policy approach, which includes a full continuum of evidence-based options as well as innovative life-saving strategies to meet people where they are and provide them with the support they need. Mr. Speaker, substance use is an extremely complex issue, and Canadians use drugs for a multitude of reasons. Not everyone who uses drugs is suffering from an addiction. And even when a diagnosis exists, treatment services may not be available or affordable. Moreover, not everyone is always willing, eligible, or able to enter treatment. Recovery looks different for everyone. services to keep people alive and safe, and that support better health outcomes should not be limited to just treatment services for those people with a formal diagnosis for a substance use disorder. Given the crisis is affecting people trying drug for the first time, people who use drug occasionally, and people who are struggling with an addiction in silence. There's no one-size-fits-all solution to this crisis. We need a range of interventions that meet people where they are and reduce the potential harms related to substance use. Harm reduction is a key element of that work, and that this government's strategy to address the toxic drug supply and overdose crisis. Evidence has shown us that harm reduction measures such as supervised consumption sites, in-person or virtual spotting, services safer supply, take-home Nexalon, and drug checking technologies are supporting people who use drugs by connecting them to health and social services, and most importantly, keeping them alive. For example, in one of the hardest hit provinces, evidence in British Columbia has shown that the combined effect of expanded access to take-home Nexalon programs, supervised consumption sites, and opioid agnostic treatment has been crucial to averting overdose deaths in the province. In addition, between 2015 and 2021, nearly 125,000 naloxone kits were used to reverse an overdose in BC. In 2016, there were only 2 supervised consumption sites in Canada, both in Vancouver. Since then, the number of federally approved supervised consumption sites offering services has grown to as high as 40 and are available in British Columbia, Alberta, Saskatchewan, Ontario, and Quebec. This is because we are investing in what works and where the evidence is. At these sites, more than 46,000 overdoses have been reversed, and there have been over 4 million visits. That is the point worth repeating. Mr. Speaker, the safe consumption sites the Conservative leader wants to shut down have reversed more than 46,000 overdoses since 2017. When we say that harm reduction meets people where they are, this is what we mean. These harm reduction services are saving lives every day. Spotting services support someone who is using drugs either in person or remotely by phone, video chat, or an app, and provides help in case an overdose occurs. During the first 14 months of operation, the virtual national overdose response service monitored over 2,000 substance use events and responded to over 50 adverse events. These events required an emergency response, and no fatalities were reported. Although the Conservative opposition will tell you otherwise, harm reduction efforts are not antithetical to treatment. They are part of the continuum of care. They meet people where they are, and they can connect people with the spectrum of health and social support. Thank you, Mr. Speaker.